So it's a bit like being a detective. And very rapidly I want to get the facts and paint a picture of this patient. And what Eclair does, when we open up Eclair, there are 3 tabs, and if it's a patient I haven't seen before, we have the opportunity to open up Eclair and sort by categories. And that allows me to see what kind of investigations have been done over the lifetime of this patient. And when I say lifetime, that would be the lifetime of the patient in our systems. Now, currently, our systems collect community data as well as hospital-acquired data. So we're able to see blood results that go far back for nearly 6 years into the community, as well as hospital admissions, and not just our hospital, but in fact the other regional hospitals in our region. And now that's thousands and thousands of results on a complex case, and it's a bit like looking for pearls in the stench of rotting oysters as you try and look for that information. By using the category button, you can actually look very rapidly across the lifetime of this patient in the system and see what kind of categories of information we hold. So you get specific gems like you're alerted to the fact that this patient has had cardiac investigations. Now that's quite important for me as an anaesthetist, and immediately that gets my attention. I would actually open up that box and have a look. And then once having done that, I want to see the most recent information, because 20 years worth of hemoglobins really doesn't turn me on a lot. It's the last one actually that's the most important, and how long ago it was, and perhaps a trend over the last 10, and actually Eclair does that for you as well. You can choose investigations and get a trend and have a look and see what's actually happened.
Well, one feature which I think has been very useful as well as the graphical part of the display. Often when you're talking about progression of the white count or progression of the immunoglobulin levels in people with myeloma, it's very useful to be able to pull up a graph of what the results have been doing, and that's something I've been doing more commonly recently, and find it's very useful for people to actually see how their disease is responding. And they often go away with a spring in their step when they notice their white counts that have come right down with the treatment, or their immunoglobulins come right down. And it is something which I think is very valuable for me as well, because often you have an impression of how things have been with time, but when it's all in black and white there, you can often pick up little nuances which you might not have picked up if you were just scanning the results yourself.